Okay, so let's just get right into it since I know many of us have a quite busy schedule. So, just an overview of why we're all here and why we started this event. So, as many of you know, by this time we are in an international pandemic, and because of this, many of the events that the 10th grade experiences have been canceled due to COVID. As a grade, we wanted to do something that represents our values and who we are. And we found that uh, partnering with local organizations and charities and giving back is a big part of our class identity, which is why it was imperative that when we were thinking of some ways to create new traditions and have new memories, that we wanted to plan an event that gave back. So this is why we decided to host this event here. And we started by creating a committee called the 10th Grade Community Partnerships Committee. And shout out to all of the incredible girls on that committee that are here today. I'm so appreciative of you guys. So this committee for the past, few weeks have been coordinating with our incredible chef, Michael Reed, and also some of the incredible folks here at Partners in Health to plan this event. So, what is this event? We will start by hearing a little bit more about the Partners in Health organization from Laura Susi, who will be just giving a quick slideshow about Partners in Health and what they do. If you would like to donate to Partners in Health, we will be putting a link in the chat. Then, after the presentation, our chef Michael Reed will take it away and we will begin making the delicious chocolate mousse. And that is all that we have today. I just, again, want to thank you all for coming and thank my incredible committee for putting this together. And I am so appreciative that this event could happen, even if it was on Zoom. And I'm just so happy that we could all come together for such a great cause. Thank you.
Awesome. I can go ahead and begin. Thank you so much. We are really excited to engage with you guys today. And I know I speak for everybody at PIH when I say that we're just consistently so impressed with the energy and the intelligence and the drive of your generation. And it gives us so much hope for our future. So really excited to tell you a little bit about PIH today. I know we're limited on time, so I'm going to zoom through as quickly as I can. And then if we have a little time at the end for questions, I'm happy to answer. Or I've also put my email up here and I welcome you to get in touch anytime, especially if we run out of time today with questions about Partners in Health and or anything related to how you can get involved and things like that. So really quickly, my name is Laura. I've been working at Partners in Health for just over 11 years. I started at a real point of growth for us, which was after the earthquake in Haiti in 2010. We had already been working there for a long time. And so we're a trusted organization providing healthcare after the earthquake that really gained a ton of visibility for us. So that's when I started, and we've come a long way since then. I've been in a number of different roles on the development team. So we're primarily focused on raising visibility, funds, and awareness for Partners in Health. But luckily, we get to work really closely with our colleagues on the clinical and programmatic side. So we do have a lot of direct connection to the work that's happening at all of our sites. So Partners in Health is a nonprofit, social justice, and global health organization. So most organizations like to talk about what makes them unique. And so we say that, we're not your average medical organization because we're not just focused on care delivery. We're not your average social justice organization because we're not just focused on advocacy. So instead, we're connecting these things. And really our mission connects this broad social justice view of the world with a distinctive academic and clinical model so that we can actually directly provide care, but also make lasting change on the global level. And we're really looking at the holistic picture of these social determinants of health. So, why is tuberculosis still such a massive problem in so many countries? Why is cholera still killing people in Haiti? Why is COVID-19 disproportionately affecting communities here in the US? And we've just recently started working here in the US. Why is West Africa still suffering from major outbreaks of Ebola? And so our approach to answering these tough questions is really through strong partnerships that are very comprehensive in scope. And so I'll get into that a little bit more as we go. So I just wanted to touch a little bit on these concepts that you might see as you're reading about and learning about Partners in Health, which is we believe that injustice has a cure. So in our work in the space of global public health, we see this as the first step to fighting injustice more broadly and the growing equity gap that we're seeing around the world. Healthcare is kind of the thermometer of injustice. And so we apply our skills as a group of clinicians and advocates and researchers to help restore equity and make healthcare a universal human right. So healthcare is a human right, kind of our second most popular notion or tagline that we use. And, we believe that being healthy is the most basic requirement to fulfill our potential as humans. And the right to being healthy has to become a top priority in the world in order to ensure social equity. And so our work obviously ends up intersecting with a number of other global challenges that disproportionately affect our patients, for example, climate change. And so through our work in the medical space, we're working to fight for that notion that every human being, regardless of where you were born, what your skin color is, or what social class you're in, is equally deserving of healthcare. Or as Paul Farmer, who's one of our co-founders, who's well known in the global health space, has a pretty well-known quote that is, "The idea that some lives matter less is the root of all that is wrong with the world." So where do we work? I'm not going to go through every country, but we have come a long way since 35 years ago when we were founded and initially working just in Haiti. And fast forward to today, we're working, including the US, in 12 countries around the world. We work in generally very remote areas in often very poor countries, financially speaking. And so we kind of start off working in more limited areas or just a couple of districts in these countries, but we're working in partnership at the invitation of the governments of those countries. And so we're working together with the Ministry of Health to apply our approach to building a healthcare system, a community-based healthcare system, and in that district. And with the hope that kind of the ultimate goal is that the national governments will then scale up this approach to healthcare throughout the entire country. So we don't operate in the sense of we're not trying to expand into more countries, or necessarily we don't have the resources to always provide healthcare through that whole country. But what we're trying to do is provide the knowledge and the evidence and the resources to enable countries and eventually the world to have highly functional quality healthcare systems. And this means free healthcare. Healthcare is available to everyone, paid for, subsidized by the government. And as I mentioned, it's this community-based approach. So we're hiring and training local workers. So 99% of our staff in all of these countries are local to those countries. And what this community-based model really emphasizes is exactly how it sounds. So a great kind of example to illustrate how it works. We have community health workers within communities who have built trusted relationships with the members or patients in their communities, so that if a health issue is identified, or for example, a woman is pregnant, the community health worker will then have the ability to accompany her through her journey of pregnancy, which means accompanying her to the clinic for regular prenatal screenings to identify any potential complications that could be life-threatening to the mom and or the baby, ensuring that building up to the labor and delivery, there are many regular check-ins, and then at the time of labor, we actually have mothers waiting homes at many of our sites, so that in places that are really remote, where a mom might have to hike or walk while in labor for many hours just to get to the clinic to deliver, which is obviously a major risk. Instead, they are getting there a couple days ahead of time. Their family is being looked after. If there are kids at home, it's a very holistic approach in that way. And then, mom can deliver at a clinic, or if needed, at a higher level hospital, if it's going to require more specialty care. And then afterwards, there's also, of course, postnatal care. And so that same community health worker will be checking in on mom and baby to make sure that they have all the resources that they need to thrive. And this really, maternal health is obviously a huge part of our work, but there's so much more, everything from malnutrition in a lot of kids in the places where we work, as well as the entire family, to specific diseases, HIV, tuberculosis, regular emergencies, of course, road accidents, traumatic injuries, any type of kind of healthcare need that you can think of. This is kind of the same approach that we're taking. And so, like I said, I'm not going to walk through every country, but all of this information is available on our website, and you can find more information about the particular programs in every country. It's not the same because every country is going to have different healthcare needs, but that's where the partnership is so critical, where we're working with the governments to make sure that we're providing the care that is most needed uniquely for them in their country. And so this is kind of the complex, wonkier set of graphics to sort of illustrate how we carry out the work. So I just quickly will start with the graphic here on the right is kind of our theory of change in four stages. So the true scale of our impact goes far beyond just providing medical care in the 11 countries where we work. We often talk about PIH as an academic NGO because we really use this framework for care delivery as a training platform. And like I said, we have a knowledge center. We make all of these resources available for free to anybody who wants to replicate the model. And, focused on training the next generation always of healthcare workers. Tragically, in Haiti, after the earthquake, an entire class of nurses were killed in a building that crumbled. And so you think about a country that already had such a struggling healthcare system, and then a whole class of nurses tragically were killed in the earthquake. And so, and then in places like in West Africa, where we also started recently working in 2014 with the first Ebola outbreak, so many healthcare workers were contracting Ebola at the beginning of the epidemic because they were the ones on the front lines, and there was just not, a system in place to make sure that they were protected. And so, that's a huge piece of the puzzle here is ensuring that there's educational and academic resources to train local citizens to become the next healthcare workforce. And it also is providing jobs. So we're stimulating the local economy. And, kind of thanks to the academic partnerships that we have, especially with well-known institutions like Harvard, this is all fueling trusted research that can be used to influence global healthcare on the global policy scale. So quickly, I'll just go through care. We deliver high quality healthcare where it once did not exist, ensuring every person's right and ability to survive and thrive. We fight and prevent diseases by treating the whole person. We invest in clinical education for our staff and all kinds of healthcare professionals to improve patient care and strengthen health systems for the long term. Influence, we advocate for national and global health policies that prioritize rather than marginalize the most vulnerable among us. We fight widespread bias and dogma with rigorous evidence-based results. And replication, we support national governments by sharing our replicable approach to ensure equitable access to dignified healthcare. And then quickly, the 5 ingredients, the 5 S's that Paul Farmer loves to talk about: staff, stuff, space, systems, and social support, which are all critical to ensuring a strong and healthy healthcare system. Then finally, just wanted to let you all know where you can engage more with us or find more information, of course, on our website. We are on all of the social media, even TikTok now, which is not listed here because we have a brand new TikTok account. But generally on Instagram, Facebook, Twitter, LinkedIn, YouTube, and TikTok, you can find us just by searching for Partners in Health or PIH. There's also a wonderful documentary called Bending the Arc that recently came out on Netflix. Highly recommend watching that. It is long, but it is really, really good. And you can learn all about the origins of Partners in Health. And then finally, a very well-known book among our supporters, which is called Mountains Beyond Mountains. It's written by Tracy Kidder, who he wrote a kind of the origin story of our founding, and the story of Paul Farmer and Ophelia Dahl meeting in Haiti and kind of how Partners in Health came to be. And that's a great read if you have not already read it. So I will leave it there. And if we have any time, invite you to ask questions. If not, like I said, we can follow up afterwards if you have questions. Thank you so much for your time and attention and for thinking of Partners in Health for this really great program that you all are putting on.
Thank you so much for this incredible slideshow. I just learned so much, and it just makes me even more excited to be partnering with Partners in Health. And I also just wanted to mention that in the chat, I put the donation link. So if anyone would like to donate to this incredible organization, just click that link and make sure you put it in honor of the Marlborough School so we can keep track. And yes, thank you so much.
Awesome. Thank you so much. Yes, we do get about 60% of our funding from individuals, which is amazing because it allows us to be really nimble in our work and not always have to be restricted to very complicated grant guidelines. So we are so grateful for any type of not just financial donations, but any other type of sharing and awareness raising is always just as helpful. So thank you so much.
Thank you. If there's no questions, I think we should get on to the cooking portion of our event. So I'm going to hand it off to our chef, Michael Reed.
Well, thank you everyone for joining us today. We're gonna have some fun. This is my sous chef, Mackenzie. She's gonna be helping me out. Today we're gonna be making 2 different mousses, one dark chocolate, one milk chocolate. That are gonna be delicious. And then a little crumble so you can make it into a parfait by the time we're done, and a little caramel sauce to go on top. So I know I gave you guys recipes and everything's in grams, so I'm not sure if everyone has a scale necessarily. If not, don't worry. I'm going to measure them out in cups and tablespoons and teaspoons so you guys can follow along and do that. The equipment that you'll need is basically 3 different medium-sized bowls. If you have a KitchenAid mixer, you'll need that, or a hand mixer. You'll need 2 different heavy bottom pots that are about 2 quarts to 3 quarts in size, because we're gonna do the caramel sauce and then we're gonna make the base on glaze to go into the mousse section of it. Okay, so to start, you're basically gonna get your bowls for your measuring your ingredients out. So we're gonna start with the dark chocolate mousse, which is 141 grams. No, you don't want this one. It's just basically 1 cup of dark chocolate. So we're gonna put that in 1 bowl. And then in your second bowl, probably about the same, little over 1 cup, so like 1 cup and 1/4 cup of milk chocolate. In a separate bowl. You're gonna set those aside because all we're gonna do right now is kind of mise en place everything out and weigh everything and get it staged. So you have your 2 chocolates weighed out in bowls. Okay. So now we're going to move away from the base of that chocolate mousse and we're going to start the base of the anglaise. So on the base of the anglaise, you're basically going to have to separate you're going to need a total of 3 eggs that we're going to separate, your milk and your heavy cream. And we're going to separate that into a bowl, or the eggs are going to go into a bowl. The heavy cream and milk, we're going to start warming up gently on the stove. Just on medium to low heat. We're just bringing it up to about 80 degrees so then we can temper in the egg yolks and then use the egg yolks to help thicken it up before it goes into the chocolate to melt the chocolate. So we have roughly 74 grams of heavy cream, which I'm gonna say is probably 1/3 cup of cream. So we're gonna put that in.
Just a quick, we have some questions in the chat.
Yeah.
Someone is asking how much chocolate to put in the bowl.
So for the milk chocolate, it's gonna be 1 cup and 1/4 for the milk chocolate. And then for the dark chocolate, it's gonna be 1 cup of chocolate.
Thank you.
Mm-hmm. Yeah, if there's questions, just let them type them in or I'll answer them the best I can for you guys. So we put the 1/3 cup of cream in. It's probably about 1 cup of whole milk. Now we're putting in a little bit more. So that is going to be for the base of the anglaise. An anglaise is basically used in multiple forms. Today we're going to use it for the mousse. Normally, classically, it's like for an ice cream base necessarily, which is just heating up cream, tempering sugar, and egg yolks to help it thicken and be able to turn it in an ice cream machine. So I'm just going to put this on the stove to low heat to medium heat just to bring it up to about 80 degrees.
Don't put that right here. And just to clarify, what he's doing is that 1/3 cup of heavy cream and 1/3 cup of milk that's mixed together.
So it's gonna be 1/3 cup of just heavy cream, and then 1 cup, a little bit more. So it's like probably 1 cup, 1/4, not even that, of milk.
Okay.
Combined together.
Perfect. Thank you.
Mm-hmm. So the next thing that we're going to work on as the cream is heating up is we're going to take our eggs. We're going to need 3 eggs. And we're just going to separate the egg white from the egg yolk. So you can either crack them directly into a bowl and then use your hands and separate the yolk with your fingers. If you're looking for the cleaner method, you just use the 2 eggshells to go back and forth until there's no more white. So you end up with something like that. And so you'll do that for the 3 eggs. My bad. It's not 3 eggs. It's 4 eggs total that we got to separate. So total of 4 egg yolks. Of course you want an egg.
That's not egg.
Mhm.
What the hell is that egg? Why are you moving?
So then I can separate it.
Oh.
So you guys do that. I'll give you guys a second to catch up with that. And then we'll move on.
I have one egg.
All right. So hopefully everyone has their eggs separated now. You got your 4 eggs. And then it's probably going to be, it's a 74 grams of sugar that you're going to be adding to the egg yolks. Which is probably going to be close to a half a cup. Yeah. So a little bit shy of a half a cup. So now all you're going to do is grab a whisk and basically just stir that up. It's going to change colors from a dark or yellow color into a lighter pale yellow is what you're looking for as you're whisking in the sugar. You want to mix it? You want to mix it? So as you see, it starts to get lighter in color as you incorporate air to it. So you're not going crazy. You're not trying to make it super fluffy, but you just want to make sure it's a little bit aerated necessarily. Go for it, stir.
I want to turn the pink.
Okay.
I like the pink.
Mhm. All right. Cool. Thank you. All right. Let me know if you guys are at that next stage.
How much? We have a question about how much sugar should go in the eggs.
So you're looking at saying it's probably going to be a total of 74 grams, but in cups, it's going to probably be closer to about, it's a little bit shy of a cup. So you're looking at probably 2/3 of a cup.
No, not yet.
So we have a question about the type of sugar. Is it cane sugar or brown sugar or a special kind of sugar?
So it's just going to be regular granulated sugar. When you're baking, most of the time you're going to use light brown sugar or granulated sugar, just because it will end up dissolving easier into the anglaise sauce than like a raw sugar or demerara sugar. That's going to be a little bit harder to dissolve into it.
Thank you.
Mm-hmm. All right. Should we move on to that next step, or do you guys need a little bit more time? What do you guys think?
I think we're ready to go.
All right. So on the anglaise recipe that I gave you guys, which is the base custard, right? Which is what we did for the sugar. You have the total of, or for the mousse recipes, you have the dark chocolate and white chocolate recipes. They're separated. Today, we're just going to combine them and just eyeball separating out the cream when we go to mix it. So when you're looking at the difference of the weights on the chocolate, there's only a cup of the dark chocolate. It has a higher density necessarily, which will require more cream to turn it into a mousse. The milk chocolate has more chocolate in that. It has a cup and 1/4 necessarily of chocolate. and it will need less cream as it cools down. So we basically will take out of the two recipes the 188 grams of cream. It should be close to about a cup.
We have one more clarifying question. The question is, did you put the egg yolk mix in with the heated milk?
Not yet. So what's happening right now, you have the milk on the stove and that's heating up. So we're just bringing that up to not even a simmer or a boil, just bringing it up so it's about 80 degrees. What we're gonna do after that comes up, we're gonna add a little bit of the milk and cream mixture into that bowl with the egg yolks and stir that up so it'll bring the egg yolks up to a warmer temperature, and then pour that back into the entire cream mixture and then put that back on the stove and finish cooking it on the stove.
Perfect, thank you.
So we basically added in the two different creams for both the dark chocolate and the milk chocolate recipe, which is basically like a cup and a half. Or in grams, it's going to be 188 and 98 grams total that you're adding in. So a cup and a half for everyone at home, just following along. Into the KitchenAid mixer bowl. If you don't have a KitchenAid mixer, it's not a lot of cream. You can do this by hand if you really want to and get a workout. If you have a hand mixer, you can do the whisk attachment for a hand mixer. If you have a KitchenAid, even easier. Grab your whisk attachment.
Sonia, go ahead and ask your question.
So what are we putting into the big bowl?
So in the bowl that you're about to aerate, you're just putting the cream from the dark chocolate mousse and the mousse recipe, which is going to be combined. It's going to be a cup and a half of
Okay.
whipping cream.
Sounds good. Thank you.
Mm-hmm. So you're just going to turn the mixer on. It's just going to go to medium to high heat. We're just going to mix it till it gets light fluffy, not to the point where it turns to like clumpy and butter looking. So it's only going to take by hand maybe 4 minutes, and then the machine, it's going to probably take 1.5 minutes, 2 minutes. So while that's whipping, you should take a look at your milk. Just give it a little stir necessarily to make sure it's not burning on the bottom or getting too hot. Mm-hmm. So as you can see, it sits up. It's not over whipped. It's not under whipped. It sits up nicely in the bowl. So you just basically set that aside in the time being. And then we'll basically grab the gelatin and a little bit of water. So most of the people at home, you won't be able to find gelatin sheets necessarily, but you will be able to find gelatin powder at most of your local supermarkets. So I'm going to show you how to bloom the gelatin that comes in the little packets, which is relatively simple. So we're just going to take basically cold water. We're going to put 3 tablespoons of cold water in a bowl. And then we have our gelatin for both the mousses. We're just gonna bloom them together. I'll figure out how much we actually have.
We have a question in the chat.
Mhm.
Somebody asked if the cream by itself is supposed to stand up.
So the cream that you just whisked with the whisk attachment, it should be able to stand up by itself. So it's 2 tablespoons. So for this recipe, if you're using the tablespoons, it's going to be 2 tablespoons or teaspoons, 2 teaspoons of gelatin powder that you're just going to sprinkle on top of the water that you put in the bowl. So you basically will take the water and you just gently, gentle it evenly across the surface of the water. What are you doing, bro? So all you're gonna do now that you have your gelatin in the water, you'll see that it starts to absorb the water, which is blooming the gelatin. So it looks like that necessarily. It all of a sudden starts to become a solid, more thicker substance, and you don't see the water nearly as much. That's what you're looking for.
We have another question in the chat asking what should we do if we have gelatin sheets?
Say that one more time for me.
What should they do if they have gelatin sheets?
So if you have gelatin sheets, you will basically, same kind of process, you'll basically take a bowl of water that's cold. You will submerge them completely in the water, and then you'll weigh it out in the gram format necessarily, which I think it was 2 gelatin sheets, so a total of 4 was the total recipe. You'll submerge those in water, pull them out, and they'll just be like really rubbery strips. You'll squeeze out as much of the excess water in the strips as possible, and then you're all set to go.
How long do you submerge them in water?
So you would submerge them for about probably like 2 minutes. It happens relatively quickly.
Ready for a nap? No? You okay? Need to go to the restroom? Okay.
All right, so now that the gelatin's doing its thing and blooming, we're gonna move over to the stove and we're gonna start tempering in the egg yolks into the anglaise sauce. So the cream is nice and warm, a little bit of steam coming off, but nothing crazy. You'll take a ladle. This is, I think, a 4-ounce ladle. Just incorporate 4 ounces of hot cream in. So you just incorporate that. And then once it's incorporated, you'll add it to the entire mixture off the stove, because the whole thing is not to curdle your eggs or make scrambled eggs. So now you're just basically going to put that back on the heat, still on low to medium heat. You're just gonna vigorously stir this, making sure that it does not turn into scrambled eggs. So if your heat is really high and it's bubbling, it's most likely gonna be scrambled eggs. You just want it to be low heat on this and take your time with it.
So what can you do if the cream is not standing up? This came through the chat.
So the whipped cream is not standing up. Usually it would imply that there was oil or water in the bowl necessarily, or that your cream wasn't as cold as possible. It's easier to make whipped cream out of cold cream than room temperature cream. So you may just have to start over and try again. So the basis of making this anglaise, you're really just trying to start slowly cooking the egg yolks in there, which is technically used as a thickening agent, and it'll help you get body into the mousse sauce.
We have another question in the chat.
Mhm.
Asked if you could just do kind of like a general overview of what we've done so far and kind of what we're doing right now.
So we started with measuring out the two chocolates, so the dark chocolate, light chocolate, into their individual bowls. We have made whipped cream that we're going to fold into the anglaise, or into the anglaise and chocolate after we temper the chocolate in. We bloomed gelatin that we're going to put, is the next step to put into the anglaise sauce. And then we're finishing up the anglaise sauce itself.
I'd also just like to mention that if anyone feels that they're a little bit behind, please open the email that I sent with the ingredients list, scroll to the bottom, and there will be documents with all the recipes if you want to double check a measurement or a step or something like that. And also in the chat, we will repeat some of the directions as well.
So this is not going to get like super thick. So if you're thinking about it, it's going to be like a very loose soup kind of consistency where it should just be able to coat the back of a spoon necessarily, but it's not going to be like super thick.
In terms of the heat, what kind of heat do you have under that right now?
So I'm just using an electric burner right now. That's literally at medium heat.
Thank you.
Because as you can see, it's barely having steam come off of it right now. It's not boiling. It's not doing anything. You'll see start bubbles forming just from the whisking process, but that's about it. So see how it just lightly coats it? Almost like a very loose tomato soup base almost. It's the easiest way I would describe it. Once you get us to that, you can turn off the heat, and then we're gonna go back to the bowls where the chocolates are at, and we're gonna divide this up once we add the gelatin in.
I have another question in the chat. Someone asked, what are we supposed to do with the gelatin sheet?
So if you have the gelatin sheets, you should have bloomed them in water and then pulled them out of the water and squeezed them and get any excess water out of them. If you have the gelatin powder like we used today, it's still sitting in the bowl, and we're about to put that into the hot anglaise mix because you have to dissolve the gelatin into this base. So here's all the gelatin, and then you're just gonna literally dump that in. So if you have the gelatin sheets, same thing. You're just gonna put it into the warm anglaise base
It's hot. But just like that.
And all you're gonna do is stir that in. Stirring. All right. Doesn't really take that much heat to dissolve gelatin. It really melts at a low temp. So now we have our 2 bowls of chocolate are back out.
And
And we're
sorry, would you just mind repeating those chocolate measurements?
What was that?
Repeating the measurements for our bowls of chocolate.
So it's 1 cup of dark chocolate and then one cup, 1/4 cup of milk chocolate. Okay. I know you do. All right, so we're just gonna take this and we're gonna divide it evenly between the 2 different bowls. And you wanna make sure you do this while it is still hot.
Double. That's what.
Mhm.
I like that one.
So I like to use whisks, or I like to use spatulas to be able to fold in the stuff. Plus, when you're going to fold in the cream, it's easier to use. I have a spatula on hand. You can do it with a whisk. It's all up to you. So now you have the hot anglaise base, and then you have the chocolate. You will just gently stir and incorporate that in. The chocolate will start to melt just from the residual heat from the anglaise. And you will keep stirring it until basically the yellow, white, cream color dissipates and all goes to either that dark chocolate color or the lighter brown for the milk chocolate.
And just to confirm, we haven't done anything with the whipped cream yet, right?
Not yet. It is still in the bowl. Because what we'll do is literally take this chocolate, now that we incorporated the base anglaise, you can put it in the fridge if you're in a rush, but we are just going to set it off to the side and let it kind of cool down a little bit. So then when you go to incorporate the cream that's cold, that you don't deflate all the air out of it from the hot anglaise and chocolate mixture.
What is that?
Chocolate.
I don't want to take that chocolate. It's too hard.
Yeah, it's hot chocolate. Yeah.
Yeah. I like that chocolate.
You like milk chocolate.
Yeah.
You like dark chocolate too.
Too hot.
Yeah, I know it's too hot, but you do like it.
I
Okay.
like white. I like everyone.
So as you can see, there's your dark chocolate all nicely incorporated. There's your milk chocolate all nicely incorporated. It's a little bit lighter than your dark chocolate, as you would anticipate it to be. So once you do that, you can either put it in the fridge if you're in a rush, or you can literally just set it aside and give it like 5 minutes to cool down to more of a room temperature state before you fold in the cream. So while that is cooling down, we're going to start making the caramel sauce.
Ew, that day. I don't like that day. Nay.
So decent sized pot. This is probably a little bit large because we're not making that much caramel sauce. But you want something that has a heavier bottom, a decent sized taller wall on it.
Daddy,
Hold on, baby.
what is that? What is that?
Cinnamon.
I don't know. I'm not seeing it. I'm not seeing it.
I don't know my own strength. Sugar. So I have my sugar in grams, it's 135 grams. In cups, it's probably going to be 3/4 cup of granulated sugar that we're putting in. Water.
Oh my God.
I'm missing everything. And then you'll take 35 grams or 34 grams of water, which will be 2 tablespoons of water will go into that pot. So you'll just take that with the water, sugar. Just mix it slightly. And we're gonna go back to the burner. And we're gonna turn this on to medium to low heat again. And we're gonna let this go very slow. And we're just gonna make this caramel sauce. So the key with caramel sauce is not to have it on high heat, because if you have it on high heat, the sides of your pans will start burning and you'll end up with something that's more bitter for your caramel sauce. You want something that's just nice, medium, low heat, and let it kind of, the water is gonna melt the sugar, the water will evaporate, and then you'll start caramelizing the sugar once the water's gone. So we're just gonna put that on the stove. So that's it. Just put it on the stove. Don't stir it. Don't mix it. Once it starts heating up, just let it do its thing. Low and slow. Come on, baby. All right. Ask mom to tie that.
Yeah. Yes.
All right, so now we're back to our bowls of chocolate. And now we're finally getting to the whipped cream stage of incorporating the whipped cream into the mousse. So the easy way to look at this is saying 2/3 will go into, or like 2/3 will go into your dark chocolate and 1/3 will go into your milk chocolate.
I had 2 buttons.
Oh, yeah, there's my cookies. Cookies really good. All right, once that's in there, you're going to just gently fold. So when you're thinking about folding, you're going from the outside of the bowl, covering it over with the cream and incorporating that in. So you basically, same thing when you're adding in the anglaise, you're just trying to eliminate any of the streaks that you're going to see from the cream until it's nicely incorporated for both the dark and white chocolate. So now that is basic. Oh, sorry, baby. That completes the actual mousse side. The only thing you have to do now is actually cool it down. Or not cool it down. Refrigerate it for probably 3 hours, and then that gelatin will set up, and you'll have a nice mousse-like consistency. So I just have glass Pyrex that I'm using. You can use a plastic Tupperware to store it in the refrigerator, whatever fits into your fridge. So it seems like it doesn't have the right consistency, but don't worry, the gelatin, and once the chocolate cools down, you're gonna actually see it from something that seems like really liquidy compared to if you're making gelatin packets or mousse packets that you buy in the store compared to this. This has gelatin and it has real chocolate. Those two things will help that actually get to the right mousse-like consistency. So don't trip out if you think that it's too loose. If you followed all the recipe or you follow the recipes and put the right amount, it will turn out. So lids on, into the fridge they go. Close it. So by now you should hear your sugar simmering. It should have bubbles, which is a good sign. It shouldn't be getting color quite yet. If you're getting color already, which means you're ahead of mine, you're looking for a light amber color, similar to what honey looks like, is what you're looking for. And then you're basically gonna need 100 grams of heavy cream. So we're just gonna measure that out now for the caramel sauce.
Chef, we have another question in the chat.
Mm-hmm.
Whipped cream didn't stand still and they don't have any whipping cream left. Is there anything that they can do?
So say that one more time. What happened to their cream? It just didn't rise or fluff up?
It says it didn't stand still and they don't have any more whipping cream left.
Honestly, your best bet is just to try. If you don't have any, go to the store, try again. If not, you can always just try and incorporate the cream. It's ideal to have as much air as possible in the cream, but it will still set up. It'll just be a little bit thicker once it sets up.
Mackenzie. No, ma'am. No,
Chef, we have another question in the chat. Some people asked, how much whipping cream do they put in?
For the mousse or for the caramel?
For the mousse, I believe.
It was in grams. It was like a cup.
No, they're asking about the caramel.
So the caramel is going to be a half a cup of manufacturing cream is going to go in. Once it starts to turn, like, so you'll see the bubbles change from bigger bubbles to smaller bubbles. You'll start to see the color start to change to like more amber on the outside. Still don't stir it, just slightly swirl the pan and you'll start to see the color get more incorporated, but you want it to be as consistent as a solid color as possible before you add the cream in, which we're almost there for. So on mine, I basically have the water has now evaporated. It's now just melted sugar. And now we're just waiting for it to get that final color that we're looking for.
Mommy, I'm not Red Bull.
Okay, give me a second and I'll fix it.
So just be careful if your caramel's turning colors. The thing that you got to remember, take it off the heat before you put the cream in, because if you put it in and it's still under the flame, it will have the tendency to boil over depending on the size of your pot. So just be careful as you're putting in the cream into hot sugar, because it's literally going to stop it from caramelizing / burning. And you want to basically be able to dump that in as quickly as possible off the heat and then start stirring. Just be careful that you don't get steam in your face or on your hands. So as you see, I have a nice caramel color. You can kind of smell a little bit of smoke, but nothing too crazy. Looks like honey almost. Off the heat, half cup of cream. Gonna bubble up. Start whisking. So now all you're doing is literally cooking it off the heat still until it's almost all incorporated. You will put this back on the heat, but you'll put it on very low. You're basically, all you're gonna try and do is you'll end up with hard bits of sugar that haven't melted back into the cream. So you just basically put it back on low heat and literally let it do its thing. So once you feel that the caramel sauce doesn't have any major chunks of sugar left over after you add it in the cream, you can basically move on to the next step, which is relatively simple. You're looking at adding salt, which is basically 1/4 teaspoon of salt. And then you're gonna put 2.5 ounces of butter into that. So that's roughly gonna be, if you're using the butter sticks, you can calculate, I think each stick is 4 ounces per household stick. So you're almost saying it's gonna be half of one of those sticks. And all you're gonna do is whisk that in while it's still warm. You're gonna whisk that in. It's hot, baby. While it's hot, you're just whisking in the butter, and then you'll set that aside too and let that come to room temperature. So as you add the butter, you'll start to see it get glossy, which is a good thing. And you'll end up with a nice, thick, but still loose, because you want to be able to pour it and use it when it's cold and room temp. So there's your caramel sauce.
Go ahead, Sonia, ask your question.
My caramel sauce it's not really brown. It looks kind of like sugar crystals. What should I do?
So what that means is there wasn't enough water necessarily to start it. So what you can do is just add water and start again.
Okay.
Or you
Okay.
can just dump that out completely, redo the sugar and the water ratio. Just don't over mix it before you even put it on the heat. It's really just sugar, water, put it together and then put it on lower heat and it should do its thing naturally without too
Okay.
much effort on your side.
Thank you.
My hand does that. My hand does.
All right, so just on a recap. So far we finished the dark chocolate mousse, the milk chocolate mousse, the caramel sauce. So the only thing we're missing out of what we do for the restaurant, we make a crumble necessarily out of a cookie. So we just make a double chocolate cookie. So the recipe I gave you, I forget if I left the chocolate chip chunks on it. You're not gonna use the chocolate chips for this cookie because we're just looking for the actual cookie crumble part of it and not the chocolate part. So I'm gonna start walking you through my simple double chocolate chip cookie recipe really quick. And we're just gonna mix that and then we're gonna bake that off. And then I'm gonna show you a simple way to assemble the entire mousse all together. So we're going back to using the KitchenAid mixer. You're gonna need a paddle attachment for that. If you don't have the KitchenAid mixer, you can put the beaters on a hand mixer and basically use that because we're gonna basically take the sugar and the butter and cream that together until it's nicely incorporated. And then we're gonna start adding in the eggs and then our dry ingredients. So we're gonna start with basically 4 ounces of butter. Seven ounces of butter. Oh, I keep saying that. So 7 ounces of butter, which is a little bit under half of a stick or 2 sticks for you guys at home. We're not gonna go crazy on cutting it. We're just gonna cut it into decent sized cubes or chunks.
No, me.
This is butter, baby. You don't want to eat butter.
No, I didn't put that in here.
Okay, you can put that in there.
Okay.
Go.
I have another question. Somebody asked how much butter is in the cups.
So for the butter for this, it's gonna be 7 ounces. So it should be right around a total of almost 2 full sticks. A little bit shy.
Hi. I'm ready. Dad.
Thank you, baby. All right, so you got 7 ounces of butter, just diced up roughly. We're gonna do 7 ounces, which should be roughly about 1 cup of sugar.
No, not about me. Not about me. What about me?
Of granulated sugar that I just put in. Yes. All right, you can put the next one in there. So then for brown sugar, it's going to be a little bit more in volume, just because brown sugar is a little bit looser. We'll find out. So for the brown sugar at home in cup volume, it's basically a cup and 1/4 of packed brown sugar.
Dad, I need down my egg.
Yeah, hold on.
Okay, I heard. I don't open it.
No, don't open it.
Touch my
All right.
egg.
Now you have the brown sugar, granulated sugar, and the butter all in equal portions of 7 ounces or a cup of granulated sugar and 1/4 cup of packed brown sugar. You will attach this into the KitchenAid mixer with a paddle attachment, and you'll turn it on to medium speed. So all you're looking to do is really get the sugar and butter super incorporated, so it should look light, creamy, and fluffy. While that's going, you want to get out 2 whole eggs, your vanilla extract. No. Thank you.
What is that?
Salt.
I think that's
You'll need salt, baking powder,
her.
all-purpose flour, and cocoa powder. So I have a sifter and another bowl. So what's going to happen? We're going to put so this is what it looks like once you have the butter, sugar kind of mixed together. So you just basically cream the butter and sugar together. All right, so in the bowl with the sifter, we're going to combine the flour. You got 9 ounces of flour. It'll probably be like a cup and a half. So it's going to be basically 2 cups of flour with your measuring cups. And then we're adding the 2 ounces of cocoa powder. Which is going to be 3/4 of a cup. Then you're going to measure out 3/4 of a teaspoon of salt. For the restaurants and in my culinary career, we always use kosher salt, not table salt necessarily. Table salt's going to be a little bit saltier than kosher salt. So if you're using table salt, probably do 1/2 teaspoon instead of 3/4 of a teaspoon. Then same thing, baking powder, 3/4 of a teaspoon. Okay, so the reason why I put the 2 bowls together, you're basically just going to sift that together and incorporate all your dry ingredients to make sure there's no big clumps of flour or cocoa powder. So that way all your ingredients are nice and incorporated. So as you see, there's the clumps of cocoa powder left, so you just push those through. All right, so now all your ingredients that are dry are all sifted together. There's no lumps or clumps. So the next thing we're gonna do is add the eggs and the vanilla extract. So we'll turn the mixer back on to that medium speed. You're going to add 1.5 teaspoons of vanilla extract. After that, you're gonna add in your eggs, but the main thing about your eggs, make sure you add one egg at a time. Crack it, put it in there. Crack it.
We have a question in the chat asking how much butter went into the caramel sauce.
It's better than it's the caramel sauce.
So how much butter is basically, I think it was 2.5 ounces. So it's gonna be basically half of the normal home sticks that are like the little perfect squares. It's gonna be half of one of those roughly. Alright, so now you have your eggs incorporated, your vanilla extract, and then the last thing we'll do is turn the mixer down to low and then start incorporating the dry ingredients slowly into that.
3 eggs goes into the cookie mixture, right?
So 2 eggs, 2 whole eggs is what you're gonna do that. Oh. All right, so there we have it. Now you have your cookie dough base basically. So cookie dough. If you were gonna make chocolate chip cookies, all you gotta do is add in chocolate chips. And then you have a delicious house-made double chocolate chip cookie for your future lunch.
Mm.
What's that?
Eat it.
Eat it.
Good. That's good.
Good.
That is so good, Dad.
Mhm.
I want that one.
Hold on, let me get you a cookie.
Not too good.
All right. So now all we have to do, if you have an ice cream scoop, you can use an ice cream scoop, or you can just basically roughly eyeball it,
I want that
or you can use your
I want
tablespoons.
that one.
So you're just gonna basically roughly scoop out the tablespoon and roll that into a ball.
I want to do that too.
Like so.
I want to do that too.
I have a half sheet with a silicone mat on it. And you're just gonna basically put a total of like 8 of these in a row on both sides of the baking sheet. And then we're gonna bake that off at like 300 degrees for about probably 15-20 minutes. We're gonna bake them a little bit longer than we would normally cookies because we're trying to dry them out and turn them into a crumble, which I'll show you what that looks like.
That ball.
Mhm.
That is a ball.
It's a ball.
What's a ball?
Mhm.
Sometimes I ball your hand.
Mhm.
What do you do with your hand?
Because I can.
You can?
So many questions from you. So does anyone have any questions so far of where we're at and what's been going on? This is it.
Looks like we're good. Thank you so much.
I'll have one.
You want one?
Yes.
Here. Get your hands filthy, dude. Have fun. It's gonna be a Play-Doh.
Like this. Like this.
I can do that.
Yes, you can. You gotta ball it into a little ball. Here, let me see.
Oh.
There you go. Now roll it. Oh, okay. Let's wash your hand. Let's wash your hand.
Honey, was that okay?
All right.
What? I don't like it.
Okay, don't use it. But if you wash your hands, you can have this.
Huh?
You can have this if you wash your hands. Go wash your hands.
Okay. Okay.
All right. So at that point, we're almost at the plating stages. You guys have a little bit longer because you guys got to wait for the mousse to actually set up and chill for a little bit longer. Your cookies still have to bake, but I want to at least show you how I would plate a mousse parfait necessarily. So I have the pre-baked off cookies that I let chill. Now we're just gonna use our hands or in a bag, crumble these up as adding texture to the mousse. Then I have the caramel sauce that has been chilling for a little bit, so it's much thicker now than it was before. Then I have my two mousses. I'm just gonna use glasses. If you have piping bags help you out necessarily. They're not essential. I'll show you both. Okay, here you go. Go sit down. So piping bags aren't essential, but they do help you get the mousse into a smaller glass. You can use a smaller spoon necessarily and just spoon it in if you have them. They're easier, but I'll show you both ways. So I made this literally earlier today before I got back to my house at the restaurant, but it's only been in the fridge for a little bit of time. So when you look at it, you can see like the air bubbles necessarily, which means we did our job right.
No, really.
There we go.
You're good. Sorry about that, you guys. My other phone died on me. Are we still there?
Yes, we're perfect. Thank you so much.
Yep.
All right. So what I'll do is basically take the cookie. Just give some nice big pieces at the bottom of the glass.
I don't want my cookie break.
And we'll just pipe in and we'll put the tip further down and just squeeze. And then it'll come up to the glass so it comes up more even around the sides. And we'll basically repeat that again. And we'll put more crumbles on top.
You don't have to break your cookie. You can leave your cookie like that, okay?
Yeah.
And then on this layer, I like to give a nice big scoop of the caramel sauce. And then I'll switch to the other mousse. So here's your milk chocolate mousse. And then we'll do more cookies on top.
Yeah, I can hear you. You can fish this on that.
Okay. So you have that. And we'll give another nice spoonful of caramel sauce just on top.
Dad,
So there you guys have it.
Is it in your ear?
Hmm?
Is it in your ear?
No, it's over there. I can put it right here.
It's like the vibe.
That looks absolutely amazing. I'm so excited to assemble mine later. Is that the end of the recipe? And as Lila said, you may want to take a second to screenshot just so you can remember the whole presentations. Thank you so much to our chef. I know a lot of folks had to run just a few minutes ago, but thank you all for staying to the very end. And remember, if you are able to donate to Partners in Health. And thank you all for attending. Thank you again to our chef. And thank you to Lila, who was translating the chat. And yay, I'm so happy this happened.
If I can just jump in really quick before everyone leaves. I want to say a quick acknowledgement to both our chef. Thank you so much for teaching us how to make this. And to Helena, she set up this entire thing, was on our committee, making sure we were meeting the deadlines. She's the reason this is all possible. So thank you, Helena.
Thank you. Thank you, everybody, for coming.